Heilman. I'm the SASH Health Systems Educator for the state of Vermont and the SASH program. I want to welcome you to our SASH program online training for prevention and self-management of hypertension and prehypertension. I also would like you to note that this program is a result of grant funding through the Centers for Disease Control and the Vermont Department of Health, with the goal to further identify individuals with hypertension, improve awareness, and thus improve blood pressure levels. With that being said, let's look at the objectives of the training. At the end of this training, you should be able to understand blood pressure definitions through JNC 7 and the new 2014 definition of JNC 8. You should be able to utilize the SASH hypertension management protocol, understand your role as a SASH coordinator or nurse in the assessment and plan for hypertension management. You should be able to demonstrate application of an automatic blood pressure cuff. You should be able to educate a SASH participant on how to self-monitor their blood pressure. And also, I hope you walk away with some ideas on how to implement hypertension programming for your SASH panel. So why is this so important? Well, 1 in 3 Americans have hypertension, that is high blood pressure, and more than half don't have it under control. It's a major risk factor for cardiovascular disease, stroke, and kidney disease. High blood pressure, like I said, affects 1 in 3 Americans. It's responsible for 1,000 deaths per day. It costs our country a lot of money, $51 billion, as you can see at the bottom of the slide. The other thing to be aware of is that high blood pressure can also be considered a silent killer. How many of you have taken a blood pressure on a participant and they've said, "Oh, my blood pressure's high, I didn't realize that, I feel just fine." So typically there aren't signs and symptoms that go along with the participant having high blood pressure. So as stated, only about half of the folks that have high blood pressure have it under control. And if we could reduce blood pressure levels by 12 to 13 millimeters of mercury. Millimeters of mercury is the how we measure our blood pressure. That would decrease stroke by 37%, decrease coronary disease by 21%, deaths from cardiovascular disease by 25%. Has a significant impact if we were able to reduce blood pressures across our population by 12 to 13 millimeters of mercury. So make control your goal every day. That is what I'd love for us to preach to our SASH participants. Get your blood pressure checked daily, or not daily, but regularly, at home, at the doctor's office, at a pharmacy. Eat a healthy diet. How many of you have heard of the DASH diet and know what the DASH diet stands for, what that acronym stands for? Dietary Approaches to Stopping Hypertension. Read food labels so you are decreasing the amount of sodium in the American diet. There's a note on here about 90% of Americans eat too much sodium. If you read nutrition labels, you'll see that it's pretty easy to get up to 2 grams of sodium a day. Quit smoking or don't start. Adults should limit alcohol to 1 drink for women per day and 2 drinks per day for men. Also get active, maintain a healthy weight, and aim for 2.5 hours of moderate physical activity every week. And that sometimes is difficult for our SASH participants, as we know they have mobility issues, chronic pain issues. So we really need to work on getting creative with them and their healthcare team on how to accomplish some of these goals. So blood pressure definition from the 7th Joint National Committee meeting, they put hypertension into different categories, and we really liked this. Stage 1 hypertension, the systolic, which is the top number, was 140 to 159 over diastolic, which is the bottom number, 90 to 99. Stage 2 systolic was greater than 160 and diastolic was greater than 100. Prehypertension was defined as 120 to 140 over 80 to 89, and normotensive was defined as less than 120 over 80. So in 2014, we received an update from the 8th Joint National Committee meeting on hypertension, and they changed these definitions. So if a person is over the age of 60, They were defined as having hypertension if their blood pressure was 150 over 90 or higher. And if they are under 60 years old, then it would be 140 over 90 or higher would be considered hypertension. And this has created a lot of confusion within the medical community as well as our SASH nursing community. And we had to do a little bit of research and discussion with our medical experts here in the field. So how does this affect your practice? As part of the download for this program, I'm hoping that you're able to download the algorithm and we can go a little bit further into detail. But the algorithm, the SASH hypertension protocol was developed and we've updated it after reviewing it with a nephrologist from University of Vermont Medical Center and a primary care practitioner. We decided that our goal is to screen our participants to less than 140 over 90. So if they're over that number, we want to be in communication with their primary care office. We do realize that there will be about 5 to 10% of participants who do not fall in that range, and we want to collaborate with the PCP to understand what is the acceptable range and make sure we document that in DocSite. We may see some practitioners lean towards those new JNC8 recommendations. Those numbers are out there, so we may see it for sure. And always reinforce positive lifestyle practice and changes as identified. So as we work with our participants, if we note that they need some help in finding opportunities for exercise, learning about nutrition, smoking cessation, and limiting alcohol, we should be able to reinforce those changes as appropriate. So as I said, hopefully you've downloaded and printed out a copy of the SASH Hypertension Management Protocol. Here it is. It is in small print, so that's why I'm hoping that you have a copy. We're going to go through this slide by slide. The important part is for you to note that all the way to the left side of the screen, the SASH Wellness Nurse Initial Assessment and Reassessment, this is where it all starts. We're going to evaluate our SASH participant, do a fairly in-depth assessment of them, and get a set of vital signs and determine where their blood pressure is from there. Where do they fall into or out of range. So from the Wellness Nurse Assessment, we should be taking blood pressure, as always, and on reassessment as well. We should be reviewing risk factors, the wellness nurses should be, and provide education and literature on all participants. At that time, we are asking that you provide your SASH participant with a blood pressure flow sheet and make that available to them. And as they fill out that blood pressure flow sheet, gets a few readings on there, fax that over to the PCP office. Once that initial nursing assessment is completed, then we will refer back to our SASH coordinator for a person-centered interview and goal setting. If the participant's systolic blood pressure, that top number, is greater than 180, you will note on the protocol that you should do some further nursing assessment. So if the number is elevated, have your participant sit down, relax, rest for 5 minutes, make sure their back is supported, feet are on the floor, legs are uncrossed, they've got a bare arm, the cuff is 1 inch above the crook in the elbow, and they have an empty bladder. You can also ask your participant if they are taking blood pressure meds, did you take your blood pressure medication today? And I know this has happened with me, as I've heard from some of my other nurse colleagues. Many times participants have forgotten to take their medicine, or they show up at blood pressure clinic trying to get to blood pressure clinic and skip the meds. So also ask them if within the last 30 minutes have they participated in a strenuous activity? Have they had caffeine, smoked a cigarette? How are they feeling? Do they have any symptoms? Because most of the time they won't. Do they have a headache? Are they lightheaded? Ask them when they're going to see their doctor next, their primary care doctor. And maybe they're working on blood pressure medication titration, and that should be a standard 1-month follow-up with a PCP. So if that number is still elevated with a systolic greater than 180, refer your SASH participant to either the primary care office or the ER and follow up with that participant once they're home. We should always be starting the blood pressure flow sheet and plan for a follow-up visit after that PCP or ED visit. If the systolic is greater than 140 and the diastolic is greater than 90, is that participant currently being treated? If yes, they're not at goal. So we want to encourage the following. We want them to self-monitor or use the blood pressure station or come to nurse clinic, have a primary care office visit, and discuss if there's any barriers to treatment. Why are they having difficulty maybe taking medications, maybe pain for medications? That type of discussion us nurses typically have in terms of medication management. If the systolic is greater than 140 and they have not been diagnosed or treated for high blood pressure, let's follow up with a few more readings. Get at least 2 more, and if that number remains greater than 140, the systolic blood pressure is greater than 140, suggest a primary care office visit and provide the blood pressure flow sheet with the patient to take to their visit. Schedule a wellness nurse follow-up after that PCP visit has occurred. And you'll see on the protocol, we always want to follow back up with the nurse. We should be closing the loop. Pre-hypertension, which is the 120 to 139 over 80 to 89 range, that's the golden opportunity for change. And this is an opportunity for the wellness nurse to really provide information on their risks, be it with some patient education and various pieces of literature. We could also encourage periodic monitoring of blood pressure through like a nurse blood pressure clinic. Refer the patient to the SASH coordinator for person-centered interviewing and goal setting. Also education on lifestyle, and incorporate all of those pieces of education into that person's healthy living plan. If your participant is normotensive, which is less than 120 over 80, the wellness nurse again will also provide an initial review of risks, education, and literature, will encourage any lifestyle initiatives that are appropriate, and refer that person to maybe the community health team or some other community resource as appropriate. For example, have you ever had somebody with a normal blood pressure but they smoke? Well, we would love to refer them for smoking cessation if that person is open to it. The SASH blood pressure self-monitoring protocol. So this protocol is developed to help you know the steps to go through to get somebody set up with a automatic blood pressure cuff at home to self-monitor. Again, you should also have a printout of this available because the font is too small on the slides. So priorities for self-monitoring at the SASH sites, really it's those folks that are in that golden opportunity for change. Their systolic is greater than 130. They have at least 2 lifestyle risk factors. They're motivated. They want to make some changes. And you can encourage your participant to share their blood pressure records with their primary care office. And us as the SASH team, we can fax those records over to the PCP office. Additionally, we want to provide lifestyle education and any referrals to our community health team for any additional services. If your SASH participant is hypertensive and monitoring has been requested by the primary care or the participant themselves, this is a perfect opportunity to have them sign out an automatic blood pressure cuff. So again, if that number is greater than 180, we're referring them back to their primary care office or the ER. If the number is systolic greater than 140 or diastolic greater than 90, let's get the SASH participant educated on how to use an automatic blood pressure cuff and how to enter data into the blood pressure flow sheet. If the participant isn't comfortable with that, you may need to refer them to the wellness nurse blood pressure clinic or the blood pressure monitoring station. I have a picture of that further down in the slides. Educate your SASH participant on lifestyle initiatives and make referrals as appropriate to the community health team or other community resources for services. If the SASH participant is hypertensive and there's no monitoring requested or the SASH participant refuses, do your best. Encourage the SASH participant to participate in self-monitoring, educate them on the risks and benefits of doing that monitoring, and encourage lifestyle initiatives and make referrals as appropriate and as they're open to it. Make sure you're documenting all of this information in DocSite. If your SASH participant is not hypertensive, but their systolic blood pressure is greater than 130, offer self-monitoring. Again, this is the perfect person to have monitor. Offer them participant-centered lifestyle education, refer them over to community health team or other community resources for services such as nutrition counseling. I use the community health team's nutrition consultation a lot. They are very skilled at educating our SASH participants on healthy diet, DASH diet, and things to take into consideration as we're working on hypertension. So that's probably the number one referral that I make to community health team as a wellness nurse. And as a wellness nurse, we want to reassess these folks within 3 to 6 months, I would say. How to educate your SASH participant on how to use an automatic blood pressure cuff. Let's go into that. So first you want your SASH participant to be seated and calm for 5 minutes. Their arm needs to be at heart level, feet need to be on the floor, uncrossed, blood pressure cuff needs to be the appropriate size, and at the bottom right-hand corner of the slide is a little table that talks about arm circumference and the appropriate adult cuff size. Arm is bare, bottom of the cuff is 1 inch above the crook of the elbow, and the bladder is emptied. Now, arm is bare is a tough one for some of our SASH participants, and this takes reinforcement and re-education of our participants. In the winter is very difficult, and I do my best with my SASH participants and say, listen, wear a t-shirt and wear a cardigan to clinic, and then I can get a good blood pressure, because you just can't take a blood pressure over a thick sweater, sweatshirt, and even a turtleneck can sometimes be tough as well. You ideally want the arm bare, and that's going to take some time and reinforcement and education with our SASH participants. So what's wrong with this picture? I'll give you just a few minutes to think about that. The first thing is that this participant's back is not supported. Additionally, it looks like the cuff is too low. What's wrong with this picture? Overwhelmingly, everybody decided that this person looked pretty good doing her blood pressure, but she's sitting there, she's making a fist, and her legs are crossed. Not to mention she doesn't have a stethoscope in hand, so we're not quite sure what blood pressure she's measuring. And this one, the cuff is almost over the crook of the elbow. So why is proper technique important? Well, if the cuff is too small, that can lead you to an elevated blood pressure. You can see here 10 to 40 millimeters of mercury. And if it's too large, you have the opposite effect. It'll be too low. The cuff placed over the clothing can give you an abnormal reading of plus or minus 10 to 40 millimeters of mercury. Feet not flat on the floor, 5 to 15 millimeters higher. Back not supported, 5 to 15 millimeters higher. Legs crossed, 5 to 8. Patient doesn't rest 3 to 5 minutes. That can really impact your numbers, 10 to 20. Tobacco or caffeine use 6 to 11 millimeters higher. Patient in pain, we have quite a few folks that have chronic pain. Probably best to ask them how their pain level is when you're checking their blood pressure. And pain can increase blood pressure by 10 to 30 millimeters of mercury. If they're talking, 10 to 15, and full bladder, 10 to 15. So lifestyle modifications to manage hypertension, weight reduction, maintaining a normal body mass is quite important. If you look in DocSite will show you what the normal BMI should be, and maintaining a normal BMI will bring systolic blood pressure down 5 to 20 millimeters of mercury per 10 kilograms of weight loss. That's pretty significant. Adopting the DASH eating plan, dietary approaches to stopping hypertension. So that's a diet rich in fruits, vegetables, low-fat dairy products, and a reduced salt content and total fat. And that can bring blood pressure down 8 to 14 millimeters. Dietary sodium restrictions, reducing dietary sodium intake to no more than 100 millimoles per day. That can bring blood pressure down 2 to 8 millimeters. Physical activity, engaged in regular physical activity such as brisk walking, That can bring your blood pressure down 4 to 9 millimeters of mercury, and moderate alcohol consumption 2 to 4 millimeters of mercury. So goal setting, these should be participant centered. We are going to come up with 10, 15, 20 things that we think that our SASH participant could do. But it's best to say that these are the things you could do. What would you like to try? And give them one or two things that they could work on. Research has shown that in healthcare, motivation improves when patients have positive experience with and trust in their providers. Empathy builds trust, is a potent motivator. Theoretically, this should translate into other relationships, like with the SASH staff as well. And celebrate baby steps. Celebrate any time your participant reduces their weight by 1 pound, where they're working really hard on measuring their blood pressure, and be supportive during that time because they may have plateaus where they don't see any impact on their numbers. So when to call the PCP? For our SASH coordinators who are assisting participants with home monitoring, if their blood pressure is greater than 180 systolic or diastolic greater than 110, have the participant sit calmly and quietly 15 to 20 minutes and recheck. If your wellness nurse is on site, call your wellness nurse and have them come to further assess the participant. If they have a blood pressure log, if that's available, is this something that has been a problem for some time, or is this coming out of the blue? And if it remains elevated and your wellness nurse is not available, encourage the participant to make a same-day phone call to their primary care office and see their primary care physician. When should they go to the ER? Well, if the participant's blood pressure remains elevated and they have any symptoms such as severe chest pain, headache accompanied by confusion, blurry vision, nausea, vomiting, severe anxiety, shortness of breath, seizures, unresponsiveness, they tell you they don't feel right or something's wrong, and notify the primary care doctor of the action that was taken. So this is normally where we have some time for practice, and once we are done with this online training, I encourage you to get a hold of an automatic blood pressure cuff. They are available at all SASH panel sites, and work with that cuff. If you're a SASH coordinator, you should be working with your wellness nurse and getting checked off on the skills checklist. So let's talk about some best practices thus far. We've learned an awful lot in the last year on things that different SASH panels are doing that have been quite successful in engaging their participants in terms of practices to promote decreases of blood pressure. So number one, how can you use automatic blood pressure cuffs at your site? This is a picture of a blood pressure monitoring station. There is a large and a medium blood pressure cuff available, sanitizers available, the blood pressure tracking forms are available. There's also a notebook for the nurse and for the SASH participant, to request a follow-up appointment. Really, I think it's great for participants to have some way to check their blood pressure, have it documented on a flow sheet, and then if they'd like further follow-up, some way for them to get in contact with the SASH coordinator or nurse. And doing this in a confidential manner is also key as well. So if your blood pressure monitoring station is not like within the SASH coordinator office, have some way for the participant to leave you a note, so anonymous, a note that is confidential for them to schedule a follow-up appointment with the coordinator or the nurse. How can you use blood pressure cuffs at your site as well? Doing a weekly, biweekly, monthly blood pressure clinic that should be held by the SASH nurse. It should be advertised on the calendar. So if you're not doing a SASH flash or monthly calendar, you should be, and that should also note when blood pressure clinic is. Target your hypertension SASH participants. If you use your SASH dashboard, you can pull up a list of your SASH participants and personally invite them to blood pressure clinic. The nurses can use the automatic cuffs, or they can continue to use manually. This is an opportunity to further identify participants willing to make lifestyle changes and or implement self-monitoring. You can also use a tool called the high blood pressure risk calculator and go through this with your SASH participants, provide a printout of it, and incorporate that into their healthy living plan. I'm going to show you this very quickly. The high blood pressure risk calculator is available on the SASH forum under Heart Health and under calculators. It's sponsored by the American Heart Association and the American Stroke Association. You put some basic demographic information in. Is this person male or female? We'll make this a woman. How old are they? We'll say they're 76. We'll make them 5', say 2. We're going to make them heavy just to prove a point, 247 pounds. And give them a zip code. And we'll say the blood pressure today we're going to make it high, just again to prove a point. 172 over 100. And we'll say this person has, let's say they've had a heart attack, they have diabetes, they smoke, they have high cholesterol. And the calculator says, oh, you've got stage 2 hypertension. It's very high. You're going to want to make lifestyle changes and talk to your healthcare professional. Your doctor will prescribe 1 or more medications to help lower your blood pressure. Click on the next button. And how much weight, here's lifestyle changes, how much weight do you plan to lose? And maybe this person says, you know what, I would be willing to lose 10 pounds. Great. How about engage in regular physical activity? No, I'm not going to do a thing. Would they be willing to eat a healthy diet? Okay, they'd be willing to get a nutritional consult. And how about lowering salt? No, let me learn about the diet first, maybe they say. Will you limit alcohol use? Maybe they already do this. So again, entered all those variables, click the next button. It says your results are almost here. And just through some lifestyle modifications, this person can reduce their blood pressure from 172 over 100 to 155 over 90. It's still high. So even with these lifestyle changes, your blood pressure after lifestyle changes may still be higher than normal. Your doctor can provide additional advice. This person really needs to go and see the doctor. And so here's another graphic that I really like. If this person did nothing, absolutely nothing, they are 6.9 times more likely than someone of their same age, gender, with a normal blood pressure of less than 120 to have a stroke. If they incorporate those few lifestyle changes that they were agreeing to do, they can drop that rate by 3 points down to 3.8. This I have found to be a nice visual for our SASH participants to see the impact of what they could do, what's within their power, and what impact they can have on their lives. From this report, you can either view or print. You can save it or email it. So you may want to print it right then and there if you can, or email it to yourself and then send it back to the participant, depending on where you are. I've also had this discussion with participants and have entered the data later and then print out the report. I'll show you what the report looks like. And then I give them the report to keep so that they have that information. Here's what the report, it's a PDF. You can put their name and the date you did it on here. And it gives you those 2 graphics as well. So that's a nice tool for you to use as well. So moving on, you could provide a heart healthy presentation. There is a presentation called Hypertension, A Guide to Prevention and Self-Management on the SASH forum. I encourage you to look at that one. It was created by Jody Velarde and Jessica Morrison, 2 of our nurses. Jody works out of Barrie, and Jessica Morrison was one of our nurse practitioner fellows. It's about 20-30 minutes of content. I've seen it presented a couple of times, and it has been received very well. You could implement a heart health workshop. Here's an example of a program that Rutland provided. They did a 4-part series of what is high blood pressure, then learning to self-monitor, how to prevent high blood pressure or lower it, and what blood pressure does to the body and medication management. Additionally, there's another 4-part heart health series called The Beat Goes On. That is on the SASH forum, and the 4 parts are the definition of what high blood pressure is. There's a review of the DASH diet. There is another part that goes through that high blood pressure risk calculator I showed you. And the final part is how to have a meaningful doctor's visit. So you could take any one of those and present them at any point in time. Those are meant to be short 15-minute presentations, all accompanied by a DASH heart healthy recipe and then some socialization. Another best practice is Walking for Wellness. This is a group out of Jericho and Essex. They needed some place to walk in the middle of the winter, and this is part of the original group. There is a lady in a white t-shirt second from the left, and she is our volunteer. She is from the Move for Wellbeing program. Move for Wellbeing is funded out of the UVM Center for Aging, and they are all about seniors getting active, exercising, and they have been a great support of our walking program. We started out with 8 participants. We have now over 30, and this is across 6 SASH panels. They would walk around an indoor soccer center field, and 7 laps was a mile, and the lady in the center is holding up a map. They walked to Virginia Beach. So at the end of the walking program, we would typically hold a little celebration with a lunch and recognize everybody's participation, because really for folks to get out of bed and go walking from 10 to 11 Mondays and Fridays from November through April in the dead of winter was just fantastic. So here's some more information for you to look at. You can download these slides, but the problem was during the winter we had to create a place for folks to get out and get active, and we needed to do this during the colder months. And like I said, we have gathered interested walkers from 3 panels, which is 3 properties. I'm sorry, 2 panels, 3 properties, and now we're up to 6 properties, a total of 5 panels. All the coordinators are involved. There's a wellness nurse that's involved. We did have a transportation issue. Fortunately, Cathedral Square has a bus, but the participants pay $2 for a round trip ticket, a punch card of $20, so you get 10 trips was how we managed that. Folks developed walking buddies. It was great support for one another, and the coordinators would also call participants. We have a few that had memory impairments and reminded them to be ready and down in the lobby for 9:30 when the bus came. We partnered with, like I said, Move for Wellbeing, and also MVP Health Plan, and they provided a few things. We got lanyards for name badges, pedometers, water bottles, and then the end of season party. So the social interaction was a soft benefit. There were some good friends made there. Additionally, there's another program that's called SASH Bucks. If you search for that on the SASH forum, you'll find some good information. SASH participants earn SASH Bucks by attending SASH programs. These eligible programs are advertised on the monthly SASH Flash on the calendar. Participants will save their SASH Bucks to use in a quarterly auction, and they can put their name in a drawing for the basket that they would like. It's a themed basket that they can put their name on, and for as many SASH Bucks as they have, they can put their name in. So if you have 20 SASH Bucks and you really like the arts and crafts basket, then you can put your name in 20 times to try and win that basket. There were 53 participants that attended the SASH Buck party that was held in June 2015, and there were over 1,400 SASH Bucks collected, and that shows you that there are over 1,400 hours of time that SASH participants reinvested really in their own health, which makes your job as SASH wellness nurses and SASH coordinators pretty evident to see that folks are really they're attending our programs and participating. And even though we may not think that we get a large volume of participants, we do have a pretty good volume, and it shows with folks like this. So what makes sense? What's doable for SASH programming? Ideally, there's 4 parts for programming for hypertension. There's a clinical program where your SASH participants have the opportunity to have their blood pressure checked. This can be weekly, biweekly, monthly, whatever makes sense for your panel. There should be an education program. I'm not saying that you have to preach about hypertension every single month, but maybe every other month or once a quarter. It could be on hypertension itself or heart health. Offer programs to raise awareness on lifestyle changes and collateral awareness on interventions such as medications, other disease processes. Think out of the box to include programs that are holistic in nature, so nutrition, stress management, medication management, how to interact with your physician, how to manage your medical record. Those are just some ideas. And also try and pull in some outside resources for folks that would come and do a talk at your SASH hub. We recently were able to get the Rite Aid pharmacist to come in and talk about hypertension and the cholesterol lowering medications. So that was very well received. He also then gave an immunization update as well, which was nice for folks to hear. An exercise program, ideally folks should be doing something that's aerobic, some strength training and flexibility. So walking for aerobic exercise or doing something in the pool is also pretty nice and aerobic. Strength training, I've heard folks are doing bone builders or some type of weights program, and then flexibility such as Tai Chi or chair yoga. Offer nutrition programs, offer programs on nutrition itself, the DASH diet, or include those types of foods with your educational program. So you can weave it into those programs also. Bottom line is if we educate our SASH participants on lifestyle changes, what is locally or immediately available for them to engage in to adopt the change that they want. So let's talk about a case study. This is Amy C. She's a SASH participant who is 65 years old. She's a white married female. She has a whole host of problems: arthritis, chronic pain, depression, hypertension. She currently takes lisinopril. She has atrial fibrillation. She's on warfarin. She's got coronary disease. She had a heart attack last fall of 2014. She's an insulin-dependent diabetic. She's obese, and recently she was diagnosed with proteinuria and referred to nephrology up at the UVM Medical Center. From a person-centered interview, Amy is 42 years old. She's got 2 children. She has been married for 42 years. She has 2 children. She's got a very supportive family, and her kids all live within 20 minutes. She goes to many school functions for the grandchildren. She drives. She has a car. She has 2 sisters. One is depressed and has been recently hospitalized for the depression, and the other, they do a lot of different activities together. She will travel with her husband on occasion. She's Roman Catholic, occasionally goes to church. She does not smoke. She does not drink. She does not exercise. She was going to cardiac rehab post MI, heart attack that is, and that was a paid incentive program. However, over the winter, this past winter of 2014-2015, she stopped due to the weather. She states she doesn't care about her diet. There's too many things to worry about due to the diabetes, warfarin, and coronary disease. She states she's lazy, she's not a morning person, and she gets up between 10 and 12, depending on how late she stays up reading. So what is different now? What are the motivating factors for her? She's being seen at nephrology, and this has her scared. There's a resident who's a friend of her and her husband's down the hall, and this good friend recently went on dialysis, and it has not gone well for this participant. So she, Amy, does not want to go on dialysis ever, and that is her current motivation. So role play, if you don't mind, you can just do this with yourself and figure out what are some SMART goals. There's a handout for a SMART goal, and figure out something that's small and measurable for her that she could take on and start addressing some of the lifestyle changes in her healthy living plan that she needs to address. And I'll give you a few minutes to do that. So, looking at your SMART goals, let's talk about what actually happened, and you can see if you were on target or not. In March of this year, the SASH team rolled out the Heart Health series, The Beat Goes On, and Amy attended 3 of the 4 parts. Due to her multiple comorbidities, she was targeted to attend this series, and during the first of the series, blood pressures were taken, and all participants were provided blood pressure flow sheets. Then, 11 days later, she goes to nephrology for consultation due to the proteinuria. She then comes to blood pressure clinic on March 26th, and the SASH team reviewed data with her, and she had just been to nephrology, and we discussed monitoring blood pressure because that's the one intervention that she really needed to look at, was lowering her blood pressure in order to affect her situation. So we right-sized her with a large automatic blood pressure cuff. We trained her, taught her how to use the blood pressure flow sheet, and provided her support. The SASH coordinator provided support phone calls to see, how was it going? Did she need any additional training? We decided to meet at the weekly nurse-run blood pressure clinics, and accountability was provided because during those clinics she would turn in her blood pressure flow sheet, and then the nurse would fax the flow sheet over to nephrology clinic. And nephrology clinic also allowed the SASH nurse to explain the starting of amlodipine and ongoing monitoring. So she started new medicine, and SASH nurse was able to educate her on that. So let's do some data review. So you can see on March 5th, her blood pressure is 138/72 with a heart rate of 64. And that was when we first started her flow sheet. Then she came to blood pressure clinic on the 26th, and her blood pressure was elevated. It was 154/78, and it continued to stay elevated. You can see through here, there's a 184/85 on the 29th of March. And these flow sheets started to get faxed over to the nephrology clinic. So the third part of what we did was, it was time for her reassessment. So we did her annual SASH reassessment. We used the high blood pressure risk calculator, incorporated that into her healthy living plan, and continued with the home blood pressure monitoring. So this is the printout from her high blood pressure risk calculator. You can see the blood pressure was 159/78. And she, after incorporating some lifestyle changes, could get her blood pressure down to 147/72, which is still high, but definitely an improvement. So she was willing to engage in some regular physical activity. She, like I said, was not willing to do anything about her diet, and she was, though, willing to also watch salt intake. She didn't drink anyway, so that wasn't a problem. But what's interesting, if you look at her bar graph over here, she does decrease her stroke incidence from 5.4 down to 3.2, but no change on the kidney disease. So she knew she had to do more, and thus the amlodipine was started. And that was started on April 15th. And you can see her blood pressure stay up in the high 140s to 150s over 60s to 70s. And here's some more blood pressure flow sheets, but then you see on May 3rd, her blood pressure comes into goal, 132/72, and she's pretty much remained there throughout the next month. So where are we now with her? The fourth part of our plan is to suggest a couple of other interventions every couple of weeks. Referral to the community health team for nutritional consultation, which she's open to. Encouraging her to go to Planet Fitness and go with her husband. That's $10 per month. She's interested in it, but I think because of summer, she doesn't want to commit to that. She is walking. We've gone from inside walking to outside walking on Tuesdays and Thursdays. It happens that she attends haphazardly, but she is walking more and is walking with her sister. We've referred her to Tai Chi, and she's thinking about it. She has not yet attended. I was hoping she would attend, but recently I've heard that still hasn't made it there. And we've talked about the Healthier Living with Chronic Disease workshop, and she is open to this, but not this summer. She wants to wait until the fall, and that's appropriate. She is out and about and getting out and doing things, so that's good. So that's the end of this presentation. I hope that you got some information out of that and can provide some additional ideas for programming. Have that discussion with your SASH coordinator, SASH wellness nurse, your team leader, your area leader, and see if there's any additional ideas you have for programming. And good luck. We will be monitoring blood pressure outcomes throughout the next couple of years according to this grant. So thank you for your time.